Good afternoon, and welcome to the Inclusion Works Lunch and Learn series. Today we are discussing employment system models. Before we get started, here are a few reminders about the webinar. Please make sure you're using a computer or smartphone connected to the internet. The audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call unless you are speaking or asking questions. To ask questions, use the Q&A feature located on your control panel, and we will answer as many questions as time allows toward the end of the presentation. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Steelman-Bridges and Susan King-Lanier. For closed captioning options, select the closed caption feature located on your control panel. To adjust your video layout and screen view, select the view feature located in the top right-hand corner of your screen and choose the view that works best for you. If you are using a mobile device, the location of the Zoom controls may vary, with the Q&A feature located on the top of the screen instead of the bottom. At this time, I'd like to turn it over to Claire Colligan, IDD Employment Lead for the IDD, TBI, and Olmstead section of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Good afternoon, everyone. Thank you so much for coming today. We are really pleased that everyone can be here today with Inclusion Works and EIPD as we discuss employment models for people with intellectual and developmental disabilities in order to improve competitive integrated employment across the state. My name is Claire Colligan. I am the IDD Employment Lead for the Division of Mental Health, Developmental Disabilities, and Substance Use Services. And I'm really excited to introduce you today to Adrienne Kittle, who is the Program Specialist for IDD at North Carolina EIPD. Welcome, Adrienne.
Thank you. Nice to be here. So I was asked to come join today to review some employment models that are supported through EIPD services. As Claire mentioned, I'm the program specialist for intellectual and developmental disabilities with EIPD, but some of the models that I'm going to go over today aren't services that individuals with IDD that aren't exclusive to the population of individuals with intellectual and developmental disabilities. So our agency serves a variety of disabilities, and these employment pathways focus on the broader eligibility group. We're going to touch on self-employment, on-the-job training, individual placement and support, supported employment, and project search. I'm going to mention customized employment and then also share some information regarding our Project Spark, which is a grant-funded program that we have now. Next slide. So as most of you on the call probably know by now, we have a new name that changed in April of 2024. With input from a variety of stakeholders, including staff and those that we serve. North Carolina Division of Vocational Rehabilitation Services relaunched as the Division of Employment and Independence for people with disabilities. So focusing on the employment services we provide, as well as the independent living services that are also available through EIPD. And as I mentioned, our purpose is to help people with disabilities achieve their goals for competitive employment and more independent living in communities across the state. Next slide. So the first one I wanted to touch on is self-employment services. I'm not sure, I think it may be one of the lesser known services that we offer. Typically, individuals come to us and want to pursue a job with an existing employer. But we do have a small number of clients that report an interest in starting their own business. So with that, EIPD can provide some modest support to help launch a new business or strengthen an existing business for eligible clients. So the services under self-employment, they're not a grant or a loan. It's just another service that we offer. Next slide. So if a client comes to us and expresses an interest in pursuing self-employment, we do want to connect them with local resources that have the knowledge and experience to support the efforts. So a counselor would as a first step, encourage clients to seek help from their local resources, such as a small business center, SCORE, which is Service Corps of Retired Executives, or the North Carolina Small Business Development Center. And these agencies have the knowledge and expertise to assist individuals in exploring their business model, help develop a business plan, and also look at financial projections to see if this pathway would meet their needs. Next slide. So the self-employment services pathway through us starts with creating a business plan, and some clients who come to us who are interested in this pathway, it may be a simple plan where they're not where their needs are just a piece of equipment in order to get started, or it can be more elaborate in terms of the business plan development. But we normally encourage, regardless of how complex the business is, for everybody to consider the development of a business plan. We want to look at evaluating the feasibility of the business, and then obviously getting at what support and funding is needed from EIPD for eligible clients. Under the self-employment services pathway, we do expect that the client contribute in some way, whether that's financially on their own or through in-kind resources. We have to look at financial eligibility before EIPD funding can be considered. And then there is an approval process, and there may be multiple layers of approval depending upon the funding that's being requested through EIPD. Next slide. So it is a process, obviously, for self-employment. So when we look at evaluating business proposals, we want to look at the vocational fit. Does the client have the vocational and business management skills to operate a business? We obviously want to look at financial fit, looking at money management skills and financial support necessary to own their own business. The personality fit gets at entrepreneurial traits needed for self-employment. We want to look at market feasibility. So is there a market for the business? Who are the other businesses that are already performing similar work in that community, and what would make this new business different, or what would you offer people? We want to look at revenue feasibility, so projected revenues that are based on solid assumptions, and then also long-term profitability. So can the business produce working capital during the development phase, and then also during operations? So next slide. So I just wanted to include a list of some of the businesses that our agency has supported. We've supported someone in starting a Medicare insurance agency, supported someone in a law office, commercial cleaning, various home maintenance and repair services. We've supported farming and a food trailer, photography, and then pressure washing for restaurant kitchens. So the next service I want to share some information on is a service called on-the-job training. And again, it's not specific to individuals with intellectual and developmental disabilities, but it can be offered to that population. On-the-job training is a training service for eligible clients who, because of their disabling condition, may require more specific vocational preparation than average workers employed in the same job. So typically in this scenario, we have an employer willing to hire our client, and that's understood before, but we know that they might require some additional training before they can perform the job. And in this case, EIPD can reimburse the employer up to 75% of the client's agreed upon wages for that on-the-job training period. So it helps offset some of those initial expenses that are incurred by the employer. And then the employer would be responsible for the mandatory employment taxes, in addition to the 25% of the total wage. And typically, on-the-job training periods last about 3 months. That's the max. There is a process if someone requires training beyond that with additional approval, but typically 3 months is what we would see for that on-the-job training period. And then obviously with successful completion of on-the-job training, it's expected that the employer would be retaining that client in employment. Next slide. So the next service I wanted to share with you is Individual Placement and Support, or IPS. So IPS is a person-centered behavioral health service to assist individuals with severe and persistent mental illness, ages 16 and up, pursue employment. So research demonstrates that individuals who obtain employment through IPS have increased income, obviously, improved self-esteem, improved quality of life. Their symptoms are reduced, and they also have reduced mental health utilization. So with IPS, there's a team of support, including mental health treatment services and rehabilitation. So there's a team. The team consists of a team lead, an employment professional, a peer mentor, and a benefits counselor. And really the focus with this service is on rapid engagement. So an individual, as long as they meet criteria for the service, we should be introducing those services as quickly as we can, regardless of their level of symptoms when they present. There's no exclusion, and employment is felt to support that person in stabilization. With this service, the funding is more blended. So EIPD funds some of the services under IPS, and then the tailored plan, LME-MCO, funds other aspects of IPS. Next slide. So I think this supported employment is one most people on the call are more familiar with. Supported employment services are for individuals with intellectual and developmental disabilities that require some level of ongoing support and extended services to maintain employment, given their specific work impediments. So our agency, EIPD, is the initial primary funding source for supported employment services. And then we typically transition to the tailored plan and LME-MCO to provide those extended services and long-term supports at whatever level is needed to maintain employment. Supported employment under EIPD is provided by a community rehabilitation provider. So the individuals get to choose which provider in that area provides the service. So our service includes an intake assessment. Sometimes we do a supplemental evaluation if there's an assessment that needs to occur to help identify what an individual's interest is related to a job goal, what their needs might be. The supplemental evaluation might be used to learn more about the client before we proceed to job development and placement. So it's individualized as to whether that would occur. But once we have a job goal identified, that's when job development and placement would be initiated through supported employment. And once a job is found, That's the intensive training when a job coach would provide supports to help the individual learn the job tasks and establish those relationships with supervisors and coworkers. And after that's completed, then we look at stabilization, and that's when the funding would shift from EIPD funded services to services through the tailored plan and the LME-MCO. And so we're really trying to establish what that is going to look like on the front end when we're making that referral. We want to figure out what the services are through the tailored plan and the LME-MCO, talk to the tailored care manager if there is one, so that we can coordinate those services, so that when EIPD helps someone find a job, we're already thinking about what funding is needed through the tailored plan to help that individual maintain the job. After stabilization, EIPD continues to follow that case for at least 90 days, just to make sure the job continues to be suitable and satisfactory, and there's no other needs that the individual needs from us. And it's after that point that we can close the case successfully. And that doesn't mean that someone can't come back to us again, as in all the services. If someone needs our help again, we can certainly take a new application and assess eligibility. But under supported employment, if the individual's needs can be met through that tailored plan and the LME-MCO funded services can continue under that funding source. Next slide. So I wanted to share a little bit of information about Project Search. So it's a unique type of supported employment that's available in North Carolina. It began in 1996 in Ohio with Cincinnati Children's Hospital Medical Center, and it was started by a nurse who worked in the emergency room in that hospital, and she would see individuals coming into the emergency room who had intellectual and developmental disabilities, and she could see that they didn't have that they weren't working and had the capacity to work. And then she also noticed within their hospital that there were job openings that they struggled to fill. And so she reached out to a special education coordinator in that area, and that's how the first partnership was formed, where that individual, the special education coordinator, helped to identify individuals with IDD who could work in the hospital. And so now from 1996, based on their website, when I put this together, there are currently 781 program sites in 48 states and 9 countries. So it's very popular. It's a licensed specific program for this population. So the focus of the program is to provide an intensive year of career search and internship experience with the business partner or employer host. And so through those internships, they develop skills in preparation for competitive integrated employment. So it is a unique partnership. There's a requirement to have an educational partner as under Project Search. The business host has to be there. So some services are funded through EIPD. So we typically, our service offers a skills trainer to support the interns during the internship phase. And then we have the community rehabilitation provider that provides the service. And then because it falls under supported employment, there is an expectation for that long-term support to continue to help someone maintain employment. And then obviously the partnership includes the interns themselves and any family members that would be supporting that intern. Next slide. So typically under Project Search, the program supports between 8 and 12 youth or young adults with intellectual and developmental disabilities. So as I mentioned, there is an educational component. So there's a teacher in the Project Search classroom, and that instruction is provided on average 60 to 90 minutes per day. and Project Search, because it's licensed, they offer lesson plans and resource material for the teams that are operating under Project Search. And then the bulk of the day after the classroom instruction is in the internships. And so throughout the course of the year, that intern would participate in 3 different internships, on average 10 weeks in length. And they build skills as they go through each internship and rotate through the various departments within the host business to build those skills and including complex skills in preparation for employment. Next slide. So during the course of the year, as the intern participates in those internships, there are employment planning meetings that occur and to review the internship's progress. Those meetings can discuss where the next internship might be to build those skills based on the individual skills and interests, and then also to set employment goals. So the full purpose, obviously, of Project Search is to gain employment at the end. So really having employment as the end goal and exploring what employment opportunities exist either within the host business or in the local community that help that intern utilize those skills that were learned over the course of the internships. And Project Search does have specific goals for an intern to reach in terms of employment. So model fidelity for them, it obviously is competitive integrated employment and year-round employment, so non-seasonal employment. And the goal really is, or the hope is, to earn at least 16 hours a week minimum and the prevailing wage for the position. So under EIPD, we're not held to that for the Project Search interns that we work with, but obviously that's what we strive for to meet Project Search fidelity. But an intern through Project Search can work less than that if everybody agrees that's what makes sense for that person. So next slide. So I wanted to just tell you where how many Project Search sites there are in North Carolina now. So the vast majority of our sites involve secondary education. So often the education system is the license holder for Project Search and offers the instructor as part of the Project Search classroom and maybe a TA as well. So right now we have 11 secondary education programs, and we have 4 adult programs. So for young adults with developmental disabilities, and those, the educational partner is usually the local community college near that Project Search site. Unfortunately, 2 of our adult programs are on hiatus this year, but we're hoping that they come back next year to offer services. And the bottom section just reviews the current industry host breakout. So the vast majority of our Project Search sites involve a host business related to a hospital or healthcare. We have 2 sites that are supported in a hotel, and then 1 in a community college. And then we also have a Project Search site at Biltmore. Next slide. So I wanted to speak on customized employment for a little bit. It's not a specific service that's offered now through EIPD, but I wanted to touch on it. I know it's been mentioned in some of the recent Inclusion Works Lunch and Learn, so I just wanted to share some information about that. If you can go to the next slide. So customized employment is a process of achieving competitive integrated employment or self-employment through a specific employee and employer relationship that is personalized to meet the needs of both that individual and the employer. And that's done through a negotiation of job duties. There's a formal guided discovery phase for the individual, and it's a qualitative process that hopes to gain information and understand the job seeker in terms of what their strengths are, what their needs are and their interests. And then employment is the outcome that's customized to meet the needs of both that individual and the employer. Next slide. So I also wanted to share some information regarding Project Spark. And if you'll go to the next slide. EIPD was awarded a grant, or we applied for and received a grant from the Rehabilitation Service Administration in the fall of 2022. And the goal of the grant was to support individuals with intellectual and developmental disabilities in or considering sub-minimum wage employment to pursue competitive integrated employment. So the first year of the grant was developing the infrastructure and identifying the services that we were going to provide through the grant. And so in October of 2023 is when the services started with our pilot sites. So services can also be provided to those individuals who are not working because prior attempts were not successful, or if an individual feels they cannot work because of their disability. So we wanted to broaden it a little bit with the support of RSA to focus on those individuals either in sub-minimum wage employment, considering sub-minimum wage employment, or who wouldn't be thinking about work at all if it wasn't for the services that Project Spark could provide. Next slide. So with the Project Spark team, the grant funds allow for a community navigator or a case manager type person to coordinate the services. There are employment specialists who get to know the individual through jobs shadowing and job sampling. And they're also the staff who would be helping with job development when the client is ready to pursue employment. There's a benefits counselor on staff with the pilot site to provide benefits counseling. They go through the training to provide that support. There's a peer mentor to provide services to support the individual in pursuing employment. And then the grant also funds an admin support to assist the team. So the services that we provide under the employment specific services include job exploration, the job shadowing and job sampling, job development and placement with job coaching. But the grant funding also allows for wraparound services. So particularly when you think about the individuals who are currently in sub-minimum wage employment, if they pursue a job in the community instead, there may be some hours of the day where they're not working but want to engage in some other type of community activity like parks and recreation, classes, volunteering. The grant allows for community engagement services for individuals to participate in those services. And then again, we have a peer mentor and benefits counselor to provide those services throughout Project Spark delivery. Next slide. So through application, these are the pilot sites that were awarded the grant funding through us. So we have Chatham Trades in Siler City, Chatham County. They serve Chatham, Orange, and Lee. Tri-County Industries in Rocky Mount, and they serve Nash, Edgecombe, and Halifax counties. And then we have Wake Enterprises in Raleigh serving Wake, Johnson, and Harnett counties. So if there's anybody on the call who it fits the categories of either currently in sub-minimum wage employment or previously was working in sub-minimum wage employment, or if you've had a past experience with EIPD and you just didn't feel like services were enough to meet the needs and aren't working now, if you live in these counties and are interested in a job in the community, I certainly encourage you to reach out to the contacts listed here to ask about Project Spark, or if you're already connected with EIPD, certainly you can ask about Project Spark with your counselor. And I will say we're in year 3 of a 5-year grant at this point. So there's 2 years left of funding. And then with Project Spark Services, we do transition after the grant funding is ended. Part of our responsibility is to transition so those services can continue with funding through the Tailored Plan and LME MCOs. Next slide. So that's my contact information if anyone needs to reach me, and also a link to our website where there is Project Spark. There's information regarding Project Spark as well, and a link where you can get to our local office contact information. Any questions?
All righty. Thank you so much, Adrienne. We can now go into the Q&A portion. Thank you to everyone who has already gone ahead and submitted a couple of questions. First one we have here was submitted by Cheryl. Whose responsibility is it to complete the career profile assessment to support clients getting into service?
So, Claire, do you mean the career assessment profile through?
Cheryl, would you like to provide a bit of
I'm coming. Just trying to come back on camera, not participating. Can you ask me the question again, please?
Yeah, we have here, whose responsibility is it to complete the career profile assessment to support clients getting into service?
So the career profile assessment, I'm not sure exactly, is that an EIPD function? We have so many assessments and things that we're doing right now. I'm thinking of the career development plan, but is that what you mean?
Let's go with that. I don't see any follow-up.
Let me say this as a sort of blanket statement. So when a person completes an employment assessment that states that they are interested in pursuing competitive integrated employment, a lot of things start to happen. As everybody knows, the person has some form of a treatment team, some method of having a support team, including usually a care manager. So there'll be a care manager, there'll be a CIE coordinator, there'll be possibly an EIPD outreach manager. Those folks are all going to work together, and they're going to start the process of enrolling the person in EIPD services, which should begin the process of all of the assessments getting done and leading the person into the next part of the career development plan. I really hope that answers your question. If not, just you can reach me offline and I will help settle that better. Thank you.
And I'll add, so I deferred to Claire a little bit, because if someone applies for EIPD services, we can offer for individuals who qualify for supported employment, we can do the supplemental evaluation, which is an individualized process. So the counselor identifies, based on conversations with the eligible individual, they formulate some questions that they want answered from that supplemental evaluation. We might want to get a little bit more information about what their interests are or what their support needs are. And then when we make the referral to a supported employment provider, we ask that provider to kind of answer those questions. But that's a separate process from the career development assessment or profile. One of the career development plan may reflect that someone needs to get a referral to EIPD, and certainly we would take that application from that referral, but then our services might look a little bit different from that career development assessment specifically.
Excellent, thank you. And I do see here Sherelle was just having some issues coming off of mute. If you can try now and let us know if that answered your question.
Oh, thank you so much. I definitely appreciate that feedback. This was coming from the Via Health area. We had a QP that had gotten feedback from the care manager that she was supposed to complete the career profile. We technically haven't been trained on the career profile, and then when I reviewed the document, it was in relation to IPS services, which we don't provide. So that was kind of my trying to just get clarity for our team in the process so that the client isn't lapsed in service. Because you did have it previously, but then this got brought to our attention last week. So I've just been trying to understand where this is coming from outside of if you're supposed to
100%.
be responsible for completing it moving forward.
100%, Cheryl. This stuff can get, as we all know, this stuff can get pretty complex, and a lot of people are asking for different things. I would say in this case, and Adrian will help me out here, when the person has been enrolled in services, if they're not currently receiving EIPD services, that may be the next answer to go. Maybe you can help direct the QP that way. If they're in a different form of supportive employment at that point, again, the care manager, the CIE coordinator, all those types of things, those evaluations will be coordinated through the folks who coordinate services. So care manager, CIE coordinator, outreach coordinator, all those. I know there's a lot of titles that sound exactly the same. And I hope that answers your question, Cheryl, because I can see how some of this stuff gets confusing and people might believe that somebody else is responsible for doing a form you never heard of. So again, always going back to those people who have the answers and definitely checking with EIPD if the person is involved with that. Adrian, you want to add to that?
So if this is specific to an IPS service, and that's a little outside my area of expertise. So but I think what should happen, and I do think there's some confusion, is that the tailored care manager should be referring to the provider agency to do the assessment. But I'm happy to connect you with someone who knows a little bit more than I do about that flow. If I can get your contact information, or you can reach out to me, and if there's questions, I have a contact that
yeah, I'll definitely send it to you both just to gain more clarity, and I'll kind of share those supplemental documents that were shared with me as well. I do appreciate your feedback. Thanks again.
Thanks, Cheryl.
Thank you everyone for your input. I'm so excited to see we have a very full Q&A, so I want to do the best we can to get through them. Next question from Megan. What should the process of transitioning a person who is receiving EIPD supported employment to the LME or MCO look like? And I can repeat if necessary.
Sure. So the process should be that when we initiate a referral to a provider for supported employment services, we should be assessing whether that provider can be the one that provides that long-term support. So can the provider bill both agencies? So EIPD for the services on the front end, and then if that individual wants to use that same provider to when the funding shifts to the tailored plan and the LME-MCO. So that's when it's easiest if we have a provider that is able to tap into both funding sources. But if not, that's where it's really important for that VR counselor or EIPD counselor to work with the tailored care manager that might be involved to prep for when that long-term funding under supported employment is going to be needed, because we want another provider kind of ready to provide supports once things stabilize with the EIPD service. After that individual gets the job, has received job coaching, and is kind of in a flow on the job, that's when our funding ends, and we want to make sure that tailored the services through the LME-MCO is seamless. So it's important to get requests. That tailored care manager needs to request the funding through the LME-MCO. The provider needs to know when the job is occurring so that we can confirm there's going to be a staff person who's able to provide the supports. So it's really essential that communication happen in the beginning so that we're not in a situation where the EIPD provider has to stay in a little bit longer because there's no other provider that's available to kind of step in and take over. Does that help?
As a follow-up, Megan also asked about supported employment. Supported employment with the LME MCOs requires documentation of closure or declination. With EIPD, we often find this documentation hard to obtain. What would be your recommendation when communicating with EIPD about the need for this documentation?
So that is a question that we get a lot. And really now we are I think requesting that closure letter it happened in the past where funding where the LME MCO wanted to see that closure letter before they would authorize the funding. But really now we're trying to stress that the funding through the LME MCO can begin following our stabilization period. So as I mentioned before, we continue to follow folks for 90 days just to make sure everything's okay before we close the file. But for someone who requires significant supports or maybe an ongoing job coach to maintain employment, that LME MCO funded service can begin really before the VR case is closed. So I think if somebody's asking, if the LME MCO is asking for a closure letter, then I think we need to have those conversations with the tailored care manager to clarify that, because somebody may have some outdated information and we just need to work together. And it may be just old experience, like, for someone who may be performing in the role of the tailored care manager, they think they need a letter, but they really don't anymore. So working through those case by case is sometimes is what's needed.
I want to just jump on there also. Megan, Adrienne and I have actually been working very closely with folks from Medicaid and the tailored plans, because we know that this issue comes up and it delays payment to providers. So we are actually in the process of coming up with a system that can work for everybody. And then obviously part of that system is making sure that all of the tailored plans know what the actual requirements are and what they're not. And I know it's been arduous for a lot of people, providers, and people at the tailored plans as well. But we're really aware of this because we've heard this several times from different areas. And so I just want to reassure people that all these kinds of things that come up that no one foresaw, we're trying to smooth those out and make sure that the systems work so that people can get paid for the really good services that they're providing. So I really thank you for bringing that up. And I'm glad we got a chance to explain that we're working really hard on that question in particular.
And it also—
And this is Megan. If I could, oh, sorry. I really appreciate the feedback. And Claire, I know you and I had talked about this previously. I think from the LME MCO standpoint, and I definitely agree that documentation is not always going to be available. As Adrienne said, sometimes members are going to transition before those services end, so there's not really anything to provide in those situations. So I just think it's a situation where the system hasn't really quite caught up to the actual process. I did want to note for LME MCOs, we have to, being part of an LME MCO, we have to follow the clinical coverage policy for those services. And supported employment still has that requirement. So as you guys are tackling that issue, it's going to be really important to tackle that policy and get that updated. Otherwise, the LME MCOs are going to still continue to fall back on that from a utilization management standpoint. That's their guiding document. So I certainly appreciate all the work that you guys are doing. And if you could tackle it from that lens, if you aren't already, that would be fantastic.
Again, thank you so much, Megan. Really appreciate, I really appreciate the collaboration as well. So thank you.
Great. Thank you for your responses and for these great questions, Megan. We have an anonymous submission here. If an individual with IDD has obtained a job without supports, but would benefit or require support to keep their job, would a referral to EIPD be appropriate?
Yes. So if the individual is finding that if they're on the job without supports but are struggling for some reason or could benefit from a job coach or some other services that we offer, that would definitely be an appropriate referral. We do have, and I didn't mention it, sometimes individuals do come to us with a job already, and even under the supported employment service, we have a job retention component where we can offer the job coaching for as long as everyone agrees it's still a good job fit, then we can introduce job coaching after the job is found to help address some of those issues that individual might need to be better equipped to maintain that job.
Perfect. Thank you. Right, next up. If the end goal is to create a business and be self-employed, but the path in order to do so requires training, certifications, and work experience in the field to make that possible, how does EIPD handle that? So for example, if a person wants to eventually create some type of healthcare advocacy or services, but can't jump towards that immediately as they've been out of the healthcare industry for years, the initial goal is to get integrated back into the healthcare field by becoming certified.
So I'm not sure what certification, what the certification would be. I think with any
So this was my
self-employment.
question.
Okay.
There was a second part. It cut me off.
Oh, sure.
Sorry, but the second part of the question was the initial goal is to get integrated back into the healthcare field by becoming certified as a medical Spanish interpreter or community health worker. Like all of those require education and training, but that work and experience is needed to further any type of like end goal. But all of those are metrics that like, yes, I got the certification, I am working, did meet the 90 days, but that's not where I want to end up at. How is that handled when it's a multi-step process?
So I will say this is a good example where our services also can help someone advance in employment. So if you're working now, but still feel like you have a disability that results in impediments to employment to meet our eligibility criteria, you could certainly reapply. And the counselor taking the application kind of share with them your goal of advancing in employment, and that would be what we would explore in terms of eligibility, and if you meet eligibility criteria, we could look at the services that are needed to help you advance in employment. And certainly that could still eventually that might be on the self-employment path or advancing within your current employer.
So the current difficulty is, do I present the self-employment while we're developing our career path and those milestones? Like, it's a struggle just trying to get the initial medical, the certifications, even though I do have background in it. So I'm trying the best way to approach this with the counselor, because it's not a black and white situation.
Yeah.
I just want to know the correct pathway to present this.
So I would, and certainly I'm happy to have a conversation after our session today, but I would think it would be having a conversation with that specific counselor you're working with, and then that might be the easiest way to explore options that makes sense for your area and resources and all that. In my mind, I would think if there are, I'm not sure if there's additional courses or things that you would have to accomplish first, then that might be the service that EIPD would look at to kind of get you to the point of then being able to advance in employment.
Gotcha. I do appreciate it, but I would love to follow back up.
Sure.
Great. Thank you. Thank you for coming off mute and expanding a little bit. We have a really great question here from Amanda. So as a nonprofit that provides workforce training and job placement services, we struggle with engaging employers. We offer trainings, we have presented through the Chamber of Commerce, We've walked into businesses in person. What are the strategies that EIPD uses to attract employers to hire inclusively?
So we do have, I don't think I mentioned it on the call today. So one of the roles of staff in our agency are business relations representatives. And with those individuals, their key responsibility is to go out and talk with local employers to establish those relationships and identify what their needs are so that they can look to us when they have an opening for so that we can refer qualified applicants for those open positions. But we also provide other support to the employers through our business relations representatives. So sometimes we can offer different trainings on disability resources. We have a windmills training series that's available that our BRRs facilitate. So it's just building those relationships so that employers know that we're a resource. We serve dual customers. We serve the business, and then we also support individuals who are eligible for our services, but we try and make those connections to both.
Okay, that makes sense. I wasn't sure if there was a particular pitch that is helpful because it sounds like the strategies we're using are pretty similar, but it's just there's no response or interest from businesses. So that's just where we get stuck.
So, and I don't know where you're based out of, but I would certainly think that reach out to our the business relations representative in the office where you are. That for an
Okay.
individual conversation might be something that you could
Yeah,
work.
I'm
that you
down in
could-
Charlotte. Do you know who a good contact would be?
So on our website there is a link to the local offices, and I would think that in the Charlotte you could just ask for the business relations representative, and that person could share some employer resource information or what they do. And even for you as an employer or nonprofit, there might be some connections we could make there.
Okay, thank you.
Amazing. We are doing great getting through these. There are a couple of location-specific questions here as well. I'm going to try to consolidate. So for example, is it possible to start a Project Spark program in a different county? And can we get these implemented in a county that is not currently offered?
And so Project Spark related to the grant. At one point we were talking through whether to expand, but right now I don't think there's an intent to do that. We're trying to build the referrals within the 3 pilot sites that we do have. So unfortunately, Project Spark is limited to those counties that were listed. And I will say, so I confused the two as well, but Project Search, the other supported employment program that has the internship period for a year. I mean, that I get, I'm the statewide coordinator for Project Search, and I will fairly frequently get emails expressing interest in starting a Project Search site or team in a specific area. And so there's information on the website, on the Project Search website, that kind of talks through first steps. It is a licensed program, so there's an initial fee and somebody has to hold the license. But once someone pays that license fee, then that's when the national office with Project Search comes in and provides support to help a program get off the ground.
Great. On that same note, we have an anonymous question on how do I help someone sign up that cannot read or write? Where do we go or call someone in Wake County?
So we do have a unit office in Raleigh, and the link to our local offices is on the website. So if you want to call, they can take referral information over the phone, and certainly if there's information, if something needs to be filled out in writing, we're happy to, someone can help do that uh, as part of the referral process.
Mm.
But we should be able to collect referral information over the phone.
And it looks like we had a follow-up to that on how to help and bring a person with IDD to sign up for supported employment in Wake County. If that answers the second question as well, great. If not, please feel free to submit another question or reach out directly via email. Reach out to any of the links on the website as well. Dina has posted here in the chat the link.
Right. So if someone's interested in supported employment services, you would have to apply and be found eligible for our services. So connecting with the local office would be the first step.
Thank you, Adrienne. Okay. Another location-specific question: where do we go in Raleigh, in that area, to sign up for the IPS program?
So IPS, I would think I'm not as familiar with the IPS providers, but I would think you should be able to still contact the EIPD office and ask for the IPS service. And so, well, let me back up a second. I do think if you have a tailored care manager who is involved already, really that's the first step, because I think the tailored care manager should be the one to help connect with an IPS provider, and then EIPD services are introduced. So but certainly if you don't have a tailored care manager and want more information, I would think you could contact the local office, and a counselor familiar with IPS would be able to explain the process a little bit better.
Great. And a question from Lindsay: can EIPD help with transportation barriers, especially for clients in rural areas? If so, what options exist?
Okay. So we do have a transportation service as part of when we try to help someone look for a job. We want to look at what the transportation resources are to figure out what's going to make sense for that person long term. But we do have a transportation service for people who meet our financial eligibility criteria. We can pay, unfortunately for rural areas, a lot of times someone has to have a resource of a way to get back and forth, but then we can reimburse private mileage assistance for a period of time until that individual's working and earning a paycheck where they might be able to take over on their own. But it's not something that we can support indefinitely. So that's kind of what we have to think about when we consider what jobs would make sense for that person, whether it's transportation resources that go along with that.
Perfect. We have 2 minutes and 2 questions.
Okay.
Can long-term funding through the tailored plan kick in during the stabilization period?
Yes. So that's and that's a change. Maybe, like I said, at some point, LME-MCOs may be asking for a closure letter from EIPD, and now we're trying to emphasize that those long-term supports can happen after the stabilization period, so before we close the case.
Excellent. And what are some of the businesses that support Project Search currently?
So Embassy Suites is the one of the hotels. We have Novant Health as one of the healthcare providers. I think Moses Cone. I mentioned Biltmore. That's a unique program. Gosh, I would have to look at my list to remember the other ones. But a lot of the bigger healthcare centers like UNC and gosh, there's another one in Greensboro that Moses Cone. I'm not going to think of it. But
No,
I think if you go to the project search, the website, you can look for the North Carolina sites, and that will bring up the businesses that they're located by business host.
all right. You have done an impossible task of answering over 20 plus questions in a short amount of time. So amazing. And for folks who still have a couple I see come in, again, please feel free to reach out to us directly via email, go to the website. There are phone numbers so you can speak to a local representative. And I will pass it back to Dina, who can close us off and give us a list of additional resources.
Thank you, Carla. The recording and presentation slides for today's event will be posted on the Inclusion Works website. The link is included in the chat. There will be a brief survey following today's webinar, and we'd appreciate your time completing it. The next Lunch and Learn will be on Wednesday, March 19th, and we hope you will join us then. This concludes our webinar for today. Thank you for attending.